We'll start the session. All of you are ready?
Yeah, good morning to all of you again. So we'll start with the next device, that is ventilator. For ventilator, traditionally what is the term used was VAP, that is ventilator associated pneumonia. Similar term is also used for clinical diagnosis. When we talk about VAP surveillance, before 2013 what was used was this term, that is VAP or VAP bar new, that is PNEU. VAP bar new was a term used for CDC NHSN surveillance diagnosis of ventilator associated pneumonia. This was before 2013. So what was the disadvantages and why did we switch over to a new term called ventilator associated event? Can any of you point out what were the disadvantages with the older method of new surveillance? One of the main problem which the surveillance, if a ICN goes for a surveillance diagnosis, one of the main problem faced was about the chest X-ray interpretation. Most of the time clinicians interpret and then go treatment. Recording was very poor with interpretation of chest X-ray. Second problem was most of the criteria were very subjective. Change in the character of sputum, change in the character of secretions, all these are very subjective. There was no uniformity. In such case, even the data will not be valid if it is not collected uniformly. So these were the challenges faced before 2013. So the CDC NHSN decided that we will come up with something which is objective. All the hospital, all the ICN, whoever is doing the surveillance will arrive at the same conclusion. That is when the term VAE, that is ventilator associated events, came into picture from 2013. Before going to decide what are we going to do, VAE or VAP new surveillance, we should understand something called as this terminology, that is in-plan and off-plan surveillance. What is in-plan surveillance is, you are following CDC NHSN criteria and we are reporting, if we are reporting to the CDC NHSN, this is applicable, the in-plan surveillance is applicable only to the US hospitals where they follow the CDC NHSN criteria and the data is published by CDC NHSN. In India, what we do, we follow the CDC NHSN criteria, but we do not give our data to CDC NHSN. So, we all fall under off-plan surveillance. Okay, is this term clear? What is in-plan and off-plan? In-plan surveillance is only valid for US hospital. That too, it is not mandate for all US hospital. They can choose whether they can report to CDC NHSN or not. So, for all adult location, the recommendation is, if they are doing in-plan surveillance, it is adult VAE. Recommendation also tells that you have to follow adult VAE because the criteria is very objective. If the facility does not support or if there is technical issues or if the ICNs are finding it very difficult, then they go for new VAP, which is it is not recommended. The most recommended for adult location is adult ventilator associated events. Next, for pediatric and neonatal location, till 2018 October, it was again new bar VAP. 2018 October, CDC NHSN has validated use of PED VAE criteria, which is different from adult VAE criteria. It is again much simpler, but that is termed as PED VAE criteria. Again, new or VAP following is optional. Okay. Next is adult location without mechanical ventilation. Whenever you want to diagnose hospital acquired pneumonia, then you can go for new or VAP in all these conditions. That is adult pediatric location where the patient is not mechanically ventilated or in immunocompromised. The in-plan surveillance is not available. Option is you have to go for new bar VAP. Okay, is this clear? What to choose? The most recommended is following the ventilator associated event, both in adult and pediatric locations. Clear?
Okay, so to summarize this particular slide, you have two kind of surveillances, VAE surveillance and the new surveillance, PNEU. New surveillance is the old terminology which used to, before 2013 we used to use that. It has got lot of subjectivity because of number of symptoms and the inter-observer variations will be more. Hence, they have replaced with adult VAE. Pediatric, we used to use the same definition, new definition. 2019, even for the pediatric also, they have come up with PED VAE. So at present, if you want to do the surveillance, you have to just follow adult VAE and ped VAE. Okay, the new definition is older classification which we can ignore. Which one?
Without mechanical
New,
ventilation,
this is
that
new
is?
VAP is the terminology where new will be applicable. PNEU you have to call it. It cannot be VAP. It cannot be VAP. It will be PNEU, means pneumonia.
The name of the surveillance criteria is new bar VAP. If we are diagnosing in the patient without mechanical ventilation, also the terminology remains the same, but the mechanical ventilator criteria will not be applicable.
So I can reinforce you. PNEU, new bar VAP, is the old criteria for pneumonia. If ventilated, we can label as VAP. If non-ventilated, we can label as PNEU. This is outdated because it was having subjectivity. Now we have adult VAE from 2013 onwards, ped VAE from 2019 onwards. So now if you want to do just adult VAE and ped VAE, you have to do. For ventilated patient, non-ventilated patient, you do not have any VAE criteria. You have to follow the old criteria. That is PNEU bar VAP criteria. Clear? So we will focus this particular session on adult VAE followed by ped VAE.
How many of you are following VA in your institute? Okay, few of you. Okay. When we talk about ventilator associated events, this is the flow chart. This is just a summary. Each of these terminologies in the flow chart, we will learn it subsequently. Just to get familiarized with the terminology, I have put the flow chart. So these are the three conditions, that is ventilator associated condition. Second one is infection related ventilator associated complication and possible ventilator associated pneumonia. When we are telling it as ventilator associated pneumonia, one of these, sometime all three are categorized, but we are going to report only one, the higher in the hierarchy. Say suppose ventilator associated condition is fulfilled, infection related ventilator associated complication and PVAP. All three are fulfilled also, we are going to report it as PVAP. So when we are talking as ventilator associated events, you need to look for or you need to diagnose, surveillance diagnosis of three, that is ventilator associated condition, infection related ventilator associated complication and possible ventilator associated pneumonia. For you to tell it as ventilator associated condition, there should be mechanical ventilator criteria, that is patient should be mechanically ventilated. 2 days of baseline followed by 2 days of worsening of gas exchange criteria has to be fulfilled. Again, these definitions we will see in further slide. Just remember that for ventilator associated condition, you should have a mechanical ventilation criteria, 2 days of baseline followed by 2 days of worsening of gas exchange. If this is fulfilled, you are going to term it as ventilator associated condition. Once this is fulfilled, keep in mind you cannot jump the steps. Once your VAC criteria is fulfilled, you are going to look into other criteria. See, first VAC should be fulfilled, followed by any of this clinical condition, that is hypo or hypothermia, increase in WBC count or decrease in WBC count, plus new antimicrobial for 4 days criteria, that is called 4 qualifying antimicrobial criteria. So your VAC criteria is fulfilled along with one of it, that is either increase or decrease in temperature, the range is given, or increase or decrease in WBC, plus 4 new antimicrobial days has to be fulfilled. Then it is called as infection related ventilator associated complication. Okay, so once your IVAC is fulfilled, then you are going to look into your culture and the criteria for PVAP. That is, you look at any one of this. Your culture should be positive, either quantitative or semi-quantitative, gram stain and culture, or that I will tell you, gram stain plus qualitative culture or quantitative or semi-quantitative culture or other non-culture techniques comes as positive, you are going to diagnose as PVAP. At this point, you just remember that there are three terms, VAC, IVAC, PVAP. Once VAC is fulfilled, you are going to look for criteria for IVAC. Once IVAC is fulfilled, we are going to look for PVAP. Again, I'll show this table at the end. You'll be very clear about the definitions. So next, coming to what are the various definitions used. So the common terminologies which we have already studied, that is a present on admission and HAI does not hold good for VAE because it is not a true infection. You have seen that just by telling there is 2 days of baseline plus 2 days of worsening of gas exchange, we are going to term it as VAC. So it is not a true HAI. So there is nothing called as HAI definition for VAE. Likewise, there is nothing called present on admission. Okay, these two criteria is not there. Date of event is modified here. The first day of worsening of gas exchange is called as date of event. I'll show you the examples in next slide. Next is infection window period. Again, it is modified. 2 days before and 2 days after the date of event is called as the infection window period. It is termed as VAE window period here. That is a term used. RIT, that is repeat infection time frame, is again not applicable. Okay, so each of these definitions we'll see. So what is date of event? Date of event is nothing but the first day of worsening of gas exchange. So you have day 1 of required more than 2 calendar period of worsening of gas exchange, followed by 2 days of stability on ventilator. I'll show you the example. Just wait for this slide, then I'll show the examples in the next slide. So VAE window period is, the first VAE window period is 2 days before and 2 days after the worsening of gas exchange. Date of event is worsening of gas exchange. 2 days before and 2 days after is the window period. So can you see this example? You have one more thing. The last point here you should remember, we are not going to consider first 2 days of mechanical ventilation. So in this example you can see, this is the first column tells this is a mechanical ventilation day. Day 1, day 2, day 3, likewise of mechanical ventilation day. This tells a VAE criterion. So the patient, these are the day 1 or day 2 of stability or improvement. This is the definition for baseline. That is day 1 of baseline, day 2 of baseline. This is the day 1 of worsening of gas exchange. So day 1 of worsening of gas exchange is called as date of event. +2 -2 is the window period. So you can see here from day 3 to day 7 is the window period. With numericals I am going to tell again, somewhere in between, if you cannot understand I'll come back to this slide. Okay. Once I explain the baseline and worsening of gas exchange with numericals, this concept will be very clear. Clear. So this here, how many days is the window period? It is 5 days. That is day 3 to day 7. Next is, can you see this example? How many days is the window period? First days of worsening of gas exchanges, 3rd day of mechanical ventilator. But I told you one point, that you are not going to consider first 2 days of mechanical ventilation. So here the window period is 3 days. The window period, it's not strictly 5 days. It ranges from 3 to 5 days. I showed you an example where it is 5 days. I showed you an example where it is 3 days. Next, this example, can you see? First 2 days of mechanical ventilation, the day 1 falls on the 2nd day. So you're going to exclude these 2 days. This is the 4 days of mechanical ventilation. Are you all clear? Yeah? Yeah, I'll tell you, madam, 1 second. So in the second example, date of event is first day of worsening of gas exchange. Window period is +2 -2. But the rule says that you are not going to consider first 2 days of mechanical ventilation. So the first 2 days here is excluded. Other than that, there is no -2 here. There is only +2. 1 + 2. So it becomes 3. Here again, the day of first day of worsening of gas exchange, you cannot do -2 because that second one falls within the first 2 days of mechanical ventilation. So it becomes 4 days. All of you are clear with this? Can we move ahead? Okay. Next is when we talk about baseline and worsening of gas exchange, two terms we are going to use, that is FiO2, that is fraction of inspired oxygen, and positive end expiratory pressure. Yeah? Yeah. In this example, what is the date of event? Date of event is first day of worsening of gas exchange. Yes? -2 is what? 3 and 2, but I cannot consider 2 because it comes in the first 2 days are always omitted. We cannot consider in the window period. Yeah, so this is 1, 2, 3, 4. So it is 4 days. Your window period ranges from 3 to 5 days. Clear? Okay. It is objectively told, sir. There is no, even CDC NHSN does not tell why we are not considering. It's made uniform and objective. Okay. So what is this FiO2? FiO2 is fraction of inspired oxygen. Nothing but the normal FiO2, atmospheric oxygen, is about 21%. When there is patient is mechanically ventilated, means the patient's oxygen demand increases. Here, normally it is maintained between, it is less than 30% or less than 0.3. Whenever a patient is mechanically ventilated, depending upon the oxygen demand, the ventilator setting is kept from 0.3 to 1. Okay, this range, that is FiO2, is increased or decreased based on the patient's oxygen demand. That is what is FiO2, that is fraction of inspired oxygen. Just remember that 0.3 or less is a normal value. Anything between 30 to 100% can be the ventilator setting. That is based on the oxygen demand of the patient. Next is positive end expiratory pressure. Again, this is the pressure mechanically applied by the ventilator to the alveoli, that is terminal alveoli, so that the alveoli does not collapse. The values ranges between 0 to 15. Anything between 0 to 5 centimeter water is considered normal and equivalent. Means what? What is the meaning of this normal and equivalent is you have a value of PEEP value of 1 and 4. It means that it is 5. Any value between 0 to 5 are considered equal and equivalent. Means you have any value, say suppose you have 1 and 4, you can consider it as 5. Are you all clear? Anything less than 5 is considered normal and equivalent. You have two values, say suppose today the PEEP value is 3, tomorrow it is 4. When we are calculating, you can just take it as 5. Okay, I'll show you in the example. So this is what is the meaning of FiO2 and PEEP. In the terminology, when we look at the baseline definition, that is ventilator associated condition, you must have observed in the flow chart I showed. Actually what value we take is a daily minimum FiO2 or daily minimum PEEP. We cannot record that, we cannot take into account of each reading because sometimes it, yeah, any doubt? No, okay. Sometimes the, yeah, sorry? Yeah. So daily minimum FiO2 or daily minimum PEEP is the value which we are going to consider when we are diagnosing ventilator associated condition. Okay. So how do we come to this? How do we calculate this? Why this is required? Because for few patients the reading is taken every time. The patient is very sick, the oxygen saturation is very bad. They are going to monitor PEEP and FiO2 every 15 minutes. Whereas some patients are very stable who are just about to be removed from the ventilator, PEEP value may be monitored just twice daily. So to maintain a uniformity, we have to calculate daily minimum value. Clear? Why is this required? Are you all clear? So how do we calculate? Lowest value during the day maintain at least for 1 hour is the definition of daily minimum value. Lowest value maintain at least for 1 hour. I'll show you the example. With this there are certain rules. That is, if it is recorded hourly, means what is the definition? The value, the daily minimum value which has to be maintained at least for 1 hour. Clear? That is the definition. Say suppose for a patient it is monitored every hour. 2 o'clock, 3 o'clock, 4 o'clock, 5 o'clock. Then how many readings should you have for your daily minimum? At least 2 readings. Understood the meaning of this? In units recording hourly, every hour, for you to tell that value is present for 1 complete hour, it means that you have to have 2 consecutive readings. Say suppose the recording is every 15 minutes. If you want to know that value is maintained for 1 full hour, you should have 5 consecutive readings. Anyone has doubt in this? The value has to be maintained for 1 complete hour. Say if it is measured every 30 minutes, how many readings should we have? 3. Very good. So 3 consecutive reading. Say suppose recordings are monitored more than, say suppose it is monitored every 2 hours. You just take 1 reading, the lowest value of that particular day. I'll show you the question. So if there are, one more is, if there are no consecutive readings at all, there is no consecutive throughout the day, it's highly variable, you just go and choose the lowest value. Okay. In this example, can you tell me what is the daily minimum PEEP value? You have recording every hour. So how many consecutive readings you look for? Yes. Yeah. You look for 2. So what is the answer here? So all of you are clear with this example? Anyone has doubt? Because the daily, what is the minimum, the one value which is maintained at least for 2 hours. Minimum, we are calculating daily minimum value. So here 5 is maintained at least for 2 hours. We are going to take here as 2. Daily minimum PEEP for this particular example is 5. Clear? Next example, can you tell me what is the daily minimum PEEP? You have a consecutive reading. The rule of going to the lowest is when there is no consecutive reading. You have a consecutive reading. So what is the value here? Are you all clear? No, few people are still up. See, no, here it is 8. You cannot take 5 because you have 2 consecutive reading. If that was not there, then you can go for the lowest reading. Are you all clear?
See,
Yes.
all these are required. Why you tell? The reason behind why all these are required is who is maintaining the ventilator setting, ICNs or the ICU people? ICU people, they maintain. So depending upon what is their strategy, they will maintain every 1 hourly, every 4 hourly, every 15 minutes. It is according to the ICU policy. So when the infection control nurse will go for seeing that what is the daily minimum value. So depending upon how frequently the ICU is going to monitor, accordingly all these rules you have to apply, and you need to find out what is your daily minimum PEEP or FIOD. Okay.
So next we will define the most important definition, that is what is baseline and what is worsening of gas exchange. Okay. Baseline definition tells that it is characterized by 2 or more days of stable or decreasing daily minimum FiO2 or PEEP values. Baseline means the patient is either, your values are either stable or it should reduce. That is the meaning of baseline. You should have values, it should be consistent or it should be reducing. It cannot increase. Clear? So you have, can you tell me which values are reducing here? You can see 6 and 2 is reducing. But the definition continues with this. You just hold on. The definition tells that, the true definition tells that baseline value means you should have 2 days of reducing or stable followed by worsening of gas exchange. For that you should also understand what is worsening of gas exchange. Worsening of gas exchange, I'll just tell this, worsening of gas exchange is, you all understood what is PEEP and FiO2. For FiO2 value, you should have a jump of 0.2 or 20% or more. For PEEP, you should have a jump of 3 values, at least 3 values of the highest. So the definition of VAC is you should have 2 days of baseline where your values are same or reducing, followed by 2 days of worsening of gas exchange. So in this example, can you tell me where this criteria is fulfilled? I'll explain the first example. See, 6 and 2, there is reduction, but there is no increase here. You should also have consecutive increase, baseline followed by worsening of gas exchange. Whereas when you see this mechanical ventilation, day 2, the value is 2, day 3 value is 5, and followed by which the jump of PEEP is more than 3. Okay?
One second. 6 The baseline means what? Both the days ka value has to be either same or the second day ka value is less than the first day. So 6 and 2 is fine. Yes. After that you should have a jump of 3 or more. You have a jump of 3 or more here. Yeah. So please remember that any value from 0 to 5 is considered as equivalent. So 2 and 5 are same. So you don't have a jump, though it appears as you have a jump. But actually you do not have a jump. In contrast, if you go 2 and 5 appearing as if it is increasing, but it is same because you have to consider both are same, and the reading is 5. You have to take the blank reading as 5. After that you have a jump to 9. So more than 3. So therefore in this example the baseline is 2 and 5. Then the worsening is day 4 and day 5. Okay. If the worsening is on day 4 and day 5, then which is the first day of worsening here? Day 4. So the date of event is day 4. Please continue.
In this example, which 2 days are baseline?
Second example.
Second example, which 2 days are baseline? Yeah. Can you take this as a baseline? 6, 4. It should remain same or it should decrease. Here the values are reducing. Yes. So mechanical ventilation day 2, day 3, it looks like baseline is satisfied. Along with that you should, in this which is the highest value? 6. So the rule is the highest value, here 6, so 6 plus at least 3 jumps should be there. Understood? When we are calculating the increase by 3 or more values, that is PEEP value raises by 3, the highest value of the baseline you should take, then the increase, the number should be more than 3, more than or equal to 3. Clear? So in this example, 6 and 4 is baseline, followed by which the jump is 10 and then 9. So your baseline period is mechanical ventilation day 2, day 3. First day of worsening of gas exchanges, mechanical ventilation day 4, and your window period is what? Window period is what? Can you yeah, it is from 3 to 6. You cannot consider minus 2, you can only consider minus 1 because there is overlapping in the first 2 days. Okay. Okay, in this example, can you tell me which are baseline? Baseline is stable or decreasing, followed by which there is worsening of gas exchange. So, which 2 days are baseline here? Yes. Worsening of gas exchanges. Date of event is? Window period? 3 to 5, yeah. In this example, which is baseline? Worsening of gas exchange? 4 and 5. Any of you have the problem with this?
Okay, 1 second. If I will give you example that same you have 7 and 6. Okay, you have 7 and 6. After that you have 10 and 9. Is it okay? Why no? Because you should have a jump of 3 or more from the highest value of the baseline. In baseline, among these two values, the highest value is? So you should have a jump of 3 or more from 7. That means this is not fulfilling. Okay? Okay?
No, both the values. The
rule says that you can tell it is VAC. The first criteria is VAC. You can tell it is VAC if you have 2 days of baseline, immediate followed by 2 days of worsening. So you have only 1 day of worsening, second day is not fulfilling. Clear? Yeah? You didn't get this? Okay. So in this example, you have agreed that 7 and 6 is baseline? How to decide baseline means you should have baseline ka the basic criteria is the PEEP value or the FiO2 value of any 2 days. Either both the values should be same, or the second day ka value should be less than the first day. This is point number 1. Point number 2 is it should be immediately followed by worsening of gas exchange for 2 days. Worsening of gas exchange is defined as PEEP should be more than equal to 3, FiO2 should be more than equal to 0.2. Either or, both need not be either PEEP or FiO2. What is your doubt now?
These values will be there on the ICU case sheet. When our ICNs go, they see the values, they write down, and you take 2 values, whichever is fulfilling, that is consecutive days. For baseline, it should be same or reducing. For worsening of gas exchange, PEEP, you should have a jump by 3. Jump by 3 with the rule that highest value of the baseline you take, and both the values of worsening should have that jump by 3 or more. Okay, these 2 points should be kept in mind. Okay, clear?
So now I will ask you one question. 8 and 7 is a baseline or not? Baseline, but the second criteria is not fulfilled because after 7 you don't have jump. Okay, so it cannot be considered as baseline. 7 and 6 decreasing, so it can be baseline. After that you have a jump of 3 or more, 10 and 10. So it is fine. But if it is 10 and 9, in such case, the difference between 7 and 10 is 3. So no problem. But the difference between 9 and 10 is only 2. So the 7 and 9 is only 2. So you should have a jump of 3 or more. And the jump has to be the difference between the highest value of the 2 days of the baseline. In that, whichever is highest value, from there you should have a jump of 3 or more. Yeah, either PEEP or FiO2. We are just explaining here in terms of PEEP. If you take FiO2 also, it's fine. You should have a jump of 0.2. Is it there anywhere here? Anywhere you have a jump of 0.2? Where? Where? Tell me. Third and fourth day, 0.5 and 0.8. You have a baseline here, 0.7 and 0.6. Which is your baseline? 0.6 and 0.5. Okay. Then there is a jump. In this case, you can take. Okay. So we are explaining here in terms of PEEP. FiO2 also you can use the same thing. Okay. All of you are clear now? First is 8, second is 7. You cannot take this as baseline because after that you do not have a jump. You should have a jump of 3 or more. Okay? 3 or more. FiO2 it is 0.2 or more. So I'll give you one more example. If you have 2588, is it fulfilling the criteria? 2588, because though it appears to be increasing, it is same, and you have a jump of 3. Okay? 9, 7, 10, 11. No, 9, 7 is okay, but 10, 11 plus 3 is not there. Yes? So 9, 7, 12, 12. Okay? 9, 7, 12, 10. No, because compared to 9, 12 is okay, but 10 is not okay. Okay? I think now now everybody is clear. Can we move ahead to the next question?
I think we have to erase this.
No problem. You tell.
Okay. In this, can you tell me which is baseline and which is worsening of gas exchange period?
Yeah, you try to read between the lines.
This value is 10. So this is 10, 10, 8, 8, 9, 5, 6, 7, 10, 10, 8, 8, 9. Can you keep this 5, 6 as a baseline? No, because there is no jump here. 6, 7 can we consider? No, because baseline should be same or decreasing. Here your value is increasing. How can we consider it as baseline? So you cannot consider. If baseline is not satisfied, do not go to look for worsening of gas exchange at all, because VAC criteria is baseline followed by worsening of gas exchange.
Understood all of you? Here the trick is you have 6, 7, 10, 10. Okay, so it appears as if the jump criteria is fulfilled, but the baseline criteria is not fulfilled, because baseline criteria says that second Deca value has to be same or less than the first Deca value. All of you clear? Move ahead.
Okay,
Now
I answer this
use your
question using
clicker.
clicker. Which 2 days are baseline? Pooling open. Yeah. So which are the baseline period here? Can you take 9, 8 as baseline?
Let them answer.
So we'll see the answers. Yeah, most of you have got it correct. So 5, 5, that is day 4, day 5 we are considering as baseline because values are equal, followed by which day 6, day 7 is the worsening of gas exchange. Date of event is first day of worsening of gas exchange, that is day 6. From 4th to 8th will be the window period, +2 and -2. Answer this question please.
$60 of you have answered, 65 now. Can we stop?
Yeah.
Any doubt? Which is the baseline? 3 and 5, because you have a jump after that, right? So window period, okay. Okay. Then the next question.
Next question please answer. Last one not clear? Sorry? First question you were clear, I think, right? This question was clear. Next question, baseline is 3 and 5. Any value between 0 to 5 is considered equivalent. So even 3 to 5 is considered as baseline. You can just take this value as 5. Even though it appears as a jump, 0 to 5 is equivalent. You are taking this is 5 followed by which there is jump. So date of event is mechanical ventilation day 3. You cannot consider -2 because it overlaps with the first 2 days of mechanical ventilation. So from day 3 to day 5 will be the window period. Clear? Yeah. Answer this question please.
Okay, 1 second, the clicker will work and doing the repoll. Now it will work.
Okay, so 70 responses are there. Yeah, no event because any of you have doubt in this? Anyone wants explanation? Shall we move? Okay. So answer this question. Determine the daily minimum FiO2 in this case.
Yeah, so we can stop here.
So what is answer? Yeah, because any recording more than 1 hour duration with more than 1 hour gap, you just take the lowest value. Okay. What is the daily minimum FiO2 in this case?
Wait 1 second. Answer. Okay, wait.
Okay, 65 responses are there. We'll see what is the answer. Why confusion? Here, how many readings you should have if it is every 15 minutes? 5. If it is not there, just go for the lowest value. You cannot make it as 3, 2 and all. That rule is not there. If there are no, that rule value is not there, just go for the lowest value. Here, because we don't have 5 consecutive readings, you just determine the lowest value, that is 0.7. Okay? Okay. Next, so once the baseline, that is 2 days of baseline immediately followed by 2 days of worsening of gas exchange is fulfilled, then your VAC criteria is fulfilled. Once VAC is fulfilled, you look into other features to determine IVAC. In that, there are 3 sets. If you want to diagnose IVAC, first one is your VAC has to be fulfilled. Second one is one of the clinical criteria. One of this should fulfill and new antimicrobial days. So what is clinical criteria? Temperature more than 100.4 recording should be there or less than 96.8, or WBC count less than or equal to 12,000. More than or equal to 12,000 or less than or equal to 4,000. So any one of this is fulfilled. This one of the criteria for IVAC is fulfilled. Okay. Next is again one more challenging definition, that is new antimicrobial days. What is this new antimicrobial days? Here, this one thing you should remember, a new antimicrobial agent should be started in the VAE window period. This is the first rule. If you want to consider this antibiotic, suppose peptaz is started, it has to be started in the VAE window period and it should not be given in the preceding 2 days. Means what? Say suppose the mechanical ventilation day 5 peptaz is started. Okay, it is in the window period. Day 4 and the preceding 2 days, that is day 3 and day 4, that antibiotic should not be given. Okay, I'll show you the examples. Next is it should be continued for at least 4 consecutive days. It need not be the same antimicrobial agent. This criteria of a new agent in the VAE window period and preceding 2 days, it should not be given. This should be fulfilled for 4 consecutive days, and also which antibiotic has to be considered, the list is available in the CDC NHSN.
1 second, it is not for consecutive days. These days are called as qualified antimicrobial days. So 4 consecutive qualified antimicrobial days. So he is going to explain now what is the meaning of qualified antimicrobial day.
Okay. So qualifying antimicrobial days is days on which a new antimicrobial agent is started. Again, it comes with certain rules, that is 2 different antibiotic on successive days you can continue the QAD. Today meropenem is given, tomorrow vancomycin is started, day after tomorrow piptaz is started, still it is your QAD 1, 2, 3, in spite that it is a different antimicrobial agent. This is the meaning of this. 2 different antimicrobial on the same day, antibiotics started on the same day, 1 QAD. Today amikacin and piptaz is started. You cannot take it as 2 QAD. It is 1 QAD. In spite it is 2 antimicrobial agent, we are counting days, so it is 1 QAD. Okay. Next example is days in between also counted, only 1 calendar day gap is in between. Means what? Today amikacin is given, patient is having some dysfunction, so tomorrow they are going to skip the dose. Day after tomorrow again amikacin is given, skip dose in between is given. You can consider the in between day, that is tomorrow, as QAD 2. If it is between amikacin, say suppose day 1 amikacin is given, day 2 no antibiotic, day 3 again amikacin is given. It is 3 qualifying antimicrobial days. Say suppose today amikacin is given, tomorrow no antibiotic, day after tomorrow if vancomycin is started. You cannot consider the in-between day. It has to be the same antimicrobial agent if you want to count the left day. All of you are clear with this? I'll show you the example. Next is gap of...
Yeah. So amikacin is given, then nothing is there on the next day, then you have vancomycin. Then in such case you have to tell that it is 2 QAD. Amikacin is given, next day not given, next day not given, then again amikacin is given. So you cannot continue the count because you have more than 1 day gap. So this is again considered as 2 QAD.
Next is this is the what sir explained, that is gap of more than 1 day and 2 different antimicrobial given, not counted as QAD. Last point is QAD is independent of frequency, dose and renal adjustment. Because the patient has renal toxicity or acute renal dysfunction, they are telling 2 days we are not going to give antibiotic. You cannot consider that as a criteria to skip the days. So whatever QADs are there, it is independent of renal adjustment, dose and frequency. Okay, we'll show you the example. So this is the example which we will understand about QADs. In this example, the day 5 is the first day of worsening of gas exchange.
Is it visible to the whole row, last row?
Okay, this is the first day of worsening of gas exchange. Day 3 to day 7 is the VAE window period. Okay, in the first example you can see amikacin is started on the first day of worsening of gas exchange. Yes. It is given for 4 consecutive days. 2 things you should remember. First thing is antimicrobial agent has to be started in the window period. Is that criteria fulfilled here?
What is the window period here? Tell me. Tell me that from day 3 to day 7. All of you agree? Okay.
Second rule is, first is it has to be started in the VAE window period. Second is it should not be given in the preceding 2 days. So amikacin was not given in the preceding 2 days. So it is a qualifying antimicrobial agent. So it is given for 4 consecutive days. So number of QADs is 4 and it can be used to fulfill IVAC criteria. Clear? First example is clear. Next we'll move on to the second example. Meropenem is given for 2 days followed by 2 days of amikacin. So how many days of QADs it is? 4. Is the first criteria of starting in the VAE window period is satisfied? Not given in the preceding 2 days? Yes. And 4 consecutive days are there? Yes. Even though it is 2 different antimicrobial agent, you can consider it as 4 qualifying antimicrobial agent and, sorry? Yeah, that is why we are considering it as a qualifying antimicrobial agent.
No problem.
That can be done. You have to start in the window period, but the days can go beyond window period also. The rule is only it has to be started. Okay? You can, this example, second example is clear? Yeah. Third
Why
example.
this idea is, if new antimicrobial agent, why they have included is, the reason is, if the clinician is thinking that there is some infection, then only he will start a new antimicrobial agent. So this is a clue. See, VAC is, at the stage of VAC, you cannot say that the etiology is infection. At the stage of IVAC, you can partially say that it may be due to infection. Only in case of possible VAP, the culture criteria is there. Okay, clear?
Okay, in this example, can you tell me how many QADs? It is?
0, 1, 2.
Why 0? Because amikacin meropenem is started in the window period. Sorry?
No, but why you are
Window
telling?
period. It is not about date of event. Sorry? Yeah, it is not. But how many qualifying antimicrobial days? Because it was given these 2 days in the window period, it is qualifying antimicrobial day, but we do not have 4 consecutive values, so you cannot consider that for IVAC criteria. So both these questions
to levelize QAD, you have to see that it is started within the window period. Yes or no? Yes. The before 2 days antibiotic is not given. Yes or no? Fulfilled. Okay.
Next example, what is the answer? How many QADs here? How many of you tell it is 3? The in-between days can be counted if it is the same antimicrobial agent. So here it is 5 and this can be considered for IVAC criteria. Clear? Yes? Next example, can you tell me how many QADs? 3, and we do not have 4. So it is 3 QADs but cannot be considered for IVAC. Can you tell me this example? How many QADs? Why 3?
3, 4, 5. How many if you are telling 3? 3 if you have 4, 5. You have for everyone here.
So here amikacin, you can cut, this is QAD 1, 2, 3, because I am counting this because it is amikacin only is given. I cannot count this as QAD because next day is not amikacin, it is meropenem. And it is not 4 consecutive QADs. So again this cannot be considered for IVAC. For IVAC, you should have 4 consecutive qualifying antimicrobial days.
See, I want to tell you that when you have a 1 day gap, you are going to continue the count. And this 1, 2, 3 are considered as consecutive QAD. Whereas because the antibiotic is changed here, you have a gap here and one more antibiotic is started. So you have 4 QAD, but here the count is not been continued. So you have 4 QAD, but those are not consecutive. Therefore, IVAC criteria is not met. Clear?
Next example, can you tell me how many QADs? QAD criteria. It should not be started in the preceding 2 days, but here it is started. So it is 0 and you cannot consider this. So next example, can you tell me what is the number of QADs? 2 or 4? 2, because more than 1 day gap, you cannot consider it as, you cannot continue the count. So here it is 2 and again it does not fulfill IVAC. Can you see this example and tell me how many QADs? Yeah, again no consecutive values. So till here is about IVAC. So once your VAC is fulfilled along with one of the clinical criteria, that is increase or decrease in the range of temperature or WBC count more than or equal to 12,000 or less than or equal to 4,000, one of those, plus you have 4 consecutive qualifying antimicrobial days, we are going to, if it is present, all these 3, that is VAC, clinical criteria and 4 qualifying antimicrobial days, we are going to diagnose, the surveillance diagnosis will be IVAC. Okay. Once IVAC is fulfilled, we are going to look into additional criteria for PVAP. So what is PVAP? Possible ventilator associated pneumonia. One of the three
is it visible? Last row? Okay.
Sorry, previous slide. Any doubt here? Can you use mic please? I am not able to hear. No, it is not. Don't look at the date of event. The antibiotic has to be started in the, don't look at the date of event. It has to be started in the window period. Which example you are citing? This window period start from day 3. So it is started in the window period. This example, right? Fourth one? So this is started in the window period. Window period starts from mechanical ventilator day 3.
So this is QAD 1, this is QAD 2, this is 3, this is 4, this is 5. Clear now? Still not clear? What is your doubt, Svetlana? What is your doubt? Yeah, so
not preceding 2 days of date of event. It is not that. Preceding 2 days of the antibiotic, qualifying antimicrobial day. See this example. This is it is given 1 day before the window period itself. You cannot consider this as a qualifying antimicrobial agent because it was given one day preceding. Okay. Yes, before the window period.
In this example, 2 days before it is not given. This criteria is fulfilled, but it is started outside the window period.
Yeah, before the window period.
Okay, so it is not fulfilled. 6 is what? This one only.
4 consecutive QADs.
1, 2, 3.
No, but the definition it is 4 consecutive qualifying. No, but consecutive.
No, see, 1 second. It is written. Please see, continued for at least 4 consecutive QAD. Okay?
Yeah.
Now clear? Yeah.
This one. You don't know whether the next day is amikacin or not.
But with this data given, it will have written as 6.
How?
No, but we don't know what is given next day, right? That information is not there.
Up to this is fine. After that, day 8 is blank. Day 9, if you give amikacin, it will become 7.
Otherwise, it is 6.
Otherwise, it is 5 only. That is what is the rule. The rule says that if the gap is 1 day, you can continue the QAD count. If the gap is more than 1 day, the next example, the gap is not the next example, the next to next example, no? Where the gap is more than 2 days?
Here, 2 days is there.
Yeah, here the gap is more than 2 days. So in this example, you have QAD as only 2. In between are not counted. Now everybody is clear. Still some doubt? Because only 3 days, no?
4 is not there, that's why.
Yes. That side, group A, intense discussion going on. Please tell me if any doubt is there.
If more than 1 day gap, you cannot continue the count, irrespective of what antibiotic, even though
you are telling instead of vancomycin, if you have amikacin, correct? Then also the QAD will be 2 only. Yeah, no, it is not consecutive.
That's why we
So
are
it
not
cannot.
considering.
That is why we are telling no. Yeah,
Yes.
correct. Yeah, if it is amicus in here, it will be 5. Same as the previous one.
Same as this.
Yeah, because in this case, amikacin dash amikacin, so this will become 1, 2, 3. Then you have a dash. Then you have meropenem. So this you cannot consider. This meropenem you can consider. So you have 1, 2, 3 plus this 4. 4 QAD are there, but they are not consecutive because you have a gap here. Yeah, then it can. Yeah, yes.
Okay, we'll move on to the PVAP criteria. Any of you have doubt with this? In lunch break we can discuss. Okay, we'll continue now. So for PVAP diagnosis, one of these criteria, 1 or 2 or 3 has to be fulfilled to tell it as a possible ventilator associated pneumonia. So what are these? Criteria 1 tells that you should have a positive quantitative or semi-quantitative culture yielding ET aspirate culture yielding more than or equal to 10 power 5 CFU per ml, or BAL more than or equal to 10 power 4, lung tissue more than or equal to 10 power 4, or PSB sample yielding more than or equal to 10 power 3. Any one of this sample is sent and this culture report that these cutoffs are attained, then you are going to tell it as criteria for PVAP is fulfilled. Say suppose you have a lab or some peripheral lab who is not doing quantitative or semi-quantitative culture, there is an option. You should have a gram stain finding supporting the qualitative report. All samples of criteria 1, that is ET aspirate, BAL, lung tissue, PSB plus sputum has a positive culture growth not meeting this criteria and has a purulent secretion with more than or equal to 25 PMNs and less than or equal to 10 epithelial cells. That is kind of qualitative report supported by a gram stain finding can also be considered as a criteria to fulfill PVAP. Clear? Third criteria tells that any one of this is positive, that is organism identified from pleural fluid, lung histopathology yields infectious etiology, diagnostic test for Legionella, diagnostic test for respiratory virus. You have any one of these also can be considered for PVAP. So either criteria 1 or 2 or 3 is fulfilled, then you are going to tell it as PVAP. Okay, you understand the importance. No, once directly just like that looking at the ET aspirate culture report, we cannot tell that the patient is having ventilator associated event. Baseline has to be fulfilled, followed by which your IVAC criteria has to be fulfilled, then you look at the culture report. Clear? Then once this is fulfilled, it is possible ventilator associated pneumonia. So please answer these questions. Criteria for new antimicrobial agent and QAD is met, true or false? Okay, 60 plus responses are there. What is the answer here? Magnex is not a qualifying antimicrobial agent because it is started in the preceding 2 days. Why can't we consider meropenem? Meropenem is started in the VAE window period and it is not given the preceding 2 days. So we have a QAD1. Imipenem is given in the window period, not given in the preceding 2 days. So it is QAD2. Peptase is started in the window period, not given in the preceding 2 days, it is QAD3. Even though this is outside, just because it is started in the window period, it is a qualifying antimicrobial agent. Any doubt in this question? Even though it are 4 different antimicrobial agents, it has to fulfill 2 criteria. Started in the window period, not given the preceding 2 days. What matter? See here, Magnex cannot be considered. I agree, because even though it is started in the window period, it is given the preceding day. preceding 2 days. So Magnex is ruled out. Now coming to meropenem, criteria 1, it has to be started in the window period. Yes, not given the preceding 2 days. Yes, both are fulfilled. So this is our QAD 1. Imipenem also holds good the criteria. Piptaz also holds good, even though Piptaz, that time it was clarified that it can go beyond the window period, but it has to be started in the window period. Now is this clear? Yes? That also is, no, imipenem you cannot consider that time. No, that time it will become 1, 2, 3 qualifying antimicrobial. It has to be started in the window period. Yes, then also it becomes only 3 days. Because if you want to continue the count beyond window period, it has to be started. That will not be fulfilled. Any other doubt? Is
This
okay?
particular MCQ will clarify all your doubts because it has combination of
Next
of many
question,
antibiotics.
please answer. Okay, next few questions are there at the end. So this is the terminology secondary bloodstream infection. So when we this is reported for PVAP. Why? Because culture criteria comes only in possible ventilator associated pneumonia. So if you are using the culture criteria to fulfill the PVAP, okay, then you can look for the secondary bloodstream infection. Reported for PVAP if blood has a matching organism same as a respiratory specimen. Say suppose you are using non-culture criteria to fulfill your PVAP. You are having a Legionella test positive or you are having a histopathology test positive. You don't know what is the organism and you cannot look for you cannot derive anything from blood culture. Understood? So if you have a culture criteria used to fulfill the PVAP, then you look at the blood culture. If the blood culture has a similar organism, then you tell it a secondary bloodstream infection. Okay? So this is the flow chart which I showed you in the beginning. I'll read it out. So mechanical ventilator criteria plus you have a 2 days baseline period which is nothing but stable or decreasing oxygenation, along with 2 days of worsening of gas exchange. You call it as ventilator associated condition. Now I think all the terms are clear. Yes. Next is when your VAC criteria is fulfilled, you have one of these clinical criteria plus 4 new antimicrobial days. You call it as infection related ventilator associated complication. Clear? Yes. When IVAC is fulfilled, plus you have one of these criteria, that is you have a quantitative or semi-quantitative attaining the cutoffs, or you have qualitative report with your gram stain finding or any other test telling that there is an infectious etiology, then your PVAP criteria is fulfilled. Say suppose your VAC, IVAC and PVAP is fulfilled. Higher in the hierarchy is PVAP, we report it as PVAP. Do not report VAC plus IVAC plus PVAP, nothing like that. We are just going to report one event, that is PVAP. If VAC and IVAC is fulfilled, it is IVAC. Only VAC is fulfilled, it is VAC. Okay?
VAC is not fulfilled, any other events are fulfilled, then no VAE. Okay? So you cannot bypass VAC.
Clear? Okay. So please answer this question. Because this option is not there, only answering is very easy. Don't take so much time.
Yeah,
You
they have
can rule
answered.
out 2 options very easily.
74 of them they answered.
Yeah. Okay, clear? Any doubts here?
Any
Any
doubt
of you?
because only 51 of you have answered.
Any doubts? Few people have answered IVAC. Where is the new antimicrobial agent? Nothing is given. So, it doesn't fulfill, it is only VAC.
Few people have answered PVAP also.
No culture criteria.
So that fatty finger you can't help it.
Next question, please answer.
Same question with slide modification.
So 60 plus responses are there. Yeah, very good. Answer is okay. Clear? Any doubts? Any doubts? We'll move on. Answer this question, please.
Next question. Yeah.
Okay. So what is the answer here? Yeah, no VAE because your
Very good.
baseline, even though your IVAC looks like it is fulfilled, because baseline is not there, it is no event. Answer this question, please. Okay, what is the answer here? It is PVAP.
Very good.
Okay. Next question. Okay, what is the answer here? Okay, 1 second. I think some mistake here. Okay, so we'll see whether the answer is correct or not. Your VAC criteria is fulfilled. Yes. Which are the baseline? Day 2, day 3 is which is the baseline? 3 and 4. That is 5 and 5 is baseline. So your date of event is mechanical ventilation day 5. Do you have one of your clinical criteria fulfilled? Yes, you have increase in WBC count. Is the qualifying antimicrobial days attained? Yes. So your respiratory specimen yields no growth. So it is, sorry, the answer is wrong here. It is IVAC along with primary BSI. Okay. So, yeah. No,
Go
you
back to
don't.
the-
See, you can tell it as a secondary BSI.
Go back to the culture criteria. It will take a lot of time.
See,
Okay,
for your
what, you know the culture criteria, right? What are the specimens required for the culture criteria? Whether blood is there in that list? No. If blood is not there in the list, blood culture criteria cannot be used to diagnose PVAP.
And you should have for you to diagnose PVAP, you should have a culture criteria. You cannot tell it as a PVAP here because PSB is no growth. So PSB is only not there. Okay. If you, yeah.
Please clarify your doubts. I'll tell you one, sir just give me a half minute. In the same question, if the respiratory specimen grown Klebsiella, then what is your diagnosis?
Yeah, then D.
Then it is PVAP and a secondary BSI. Sir, please.
And if it is not culture is positive and Klebsiella is isolated in blood, still
You can take it as primary BSI. It is not secondary BSI. Secondary BSI for PVAP.
No, he's telling if both are positive, right?
non-cultural.
we cannot consider secondary BSI for PVAP if we use
Non-culture means?
non-culture. Respiratory viruses.
If you will identify Legionella in a respiratory specimen, then it will become PVAP for Legionella. Klebsiella pneumoniae will become primary BSI.
Primary BSI. Okay.
Yeah. 1 second, madam.
Answer is?
1 second, please. That is for new PNEU. PNEU is the old criteria for which blood culture also is one of the culture criteria for pneumonia.
That is what they are asking.
Where? Wait 1 second. His doubt has to be clarified because his face is not smiling. Yeah. That scenario what I told, no, that I have given the example is new PNEU. Okay. There for diagnosing VAP, the culture criteria may be some of the respiratory specimen or maybe the blood culture criteria also. Here the blood culture is not there in the list of the specimen. Yes? Yeah.
Sir, in this answer is IVAC plus primary BSI.
IVAC plus primary BSI, absolutely.
Yeah. Sir, can there be condition where there is IVAC plus secondary BSI? Can there be a condition?
No, because you are not.
You don't have secondary. That leads to one more question. Excellent question he has asked. Secondary BSI can happen only when you have PVAP. It cannot happen because you don't have a culture criteria at all. Clear? Here, yes, Dr. Poonam. Yeah.
The PNEU criteria, that was for the diagnosis and treatment.
No. PNEU criteria was the 2013 before criteria for surveillance.
Why did you study that?
Because before that only that was available.
No,
Till now we were telling that also a bit because it was in use for the pediatric individual. Now in this workshop we will not tell, we will not discuss about that criteria because even for pediatric also you have PVAP.
We should not think about that at all.
Yeah, don't think about that. Yeah, Dr. Prasanna. Yeah, PSB also can be used. Yes. Somebody was raising hand. Yeah. On your mic.
Sir, about PVAP primary BSI, because PVAP is already, the culture is coming as positive, then again primary BSI.
different organism. Yeah, different organism.
If PVAP has Klebsiella and you have grown, if blood has E. coli, then in such case. All the doubts are clarified? Or we are running out of time like anything. Is it okay for you? No? You are only telling that you can discuss as much as possible and you are telling, then we can skip few sessions so that you can go on time. So if everything is no, then it is a vicious cycle.
Okay, so there are few exclusions from VAE surveillance, that is patient on high frequency ventilation or extracorporeal life support or brain dead patients are not considered, lung expansion devices not considered, nasal PEEP are not considered, CPAP, hypo-CPAP, all these devices even though used for passive ventilation are excluded from VAE surveillance. Okay. There are few more exclusions, that is pathogens are excluded, the normal respiratory flora if grown in the cultures, Candida or yeast not otherwise specified excluded, cons and enterococcus comments are for all respiratory specimen except when it is grown in pleural fluid and lung tissue specimen it is considered, otherwise cons and enterococcus are excluded, even dimorphic fungi are excluded from all HAI surveillance. Next, this is how we calculate the VAE rate. VAE rate is nothing but number of cases into 1000 divided by number of ventilator days. All these presentations will be shared, so don't worry about taking the pics. So next coming to PED VAE surveillance. this surveillance before October 2018, what was used or what was recommended for neonatal and pediatric locations was VAP bar new surveillance. Okay. Now after October 2018, there was a publication by CDC which told that you can use, it is modified criteria, but it is termed as PED ventilator associated event, can be used for pediatric and neonatal location, and this is what is recommended. We are going to discuss only PED, VAE, new and VAP, we are not going to discuss here. So, all the common terminologies used for adult VAE such as mechanical ventilation criteria, date of event, window period, daily minimum values are applicable for PED VAE also. Same criteria what we discussed till now holds good, and this is very easy. What is not applicable here is VAC, IVAC and PVAP. That is not there. It is just a single step diagnosis, surveillance diagnosis, which is slightly similar to what we tell it as VAC, but the term ventilator associated condition is not used. Okay. None of these conditions are used when we are defining PED VAE. So, there are certain modification. Instead of using positive end expiratory pressure, the term used here is mean airway pressure. This is what the values we record is mean airway pressure. Then the slight numericals vary here. So, when we look for daily minimum, we look for jump of 2 in FiO2, right? Yes, here we look a jump of 0.25. That is, there we look for 0.2, here we look for 0.25 or more. This is the difference. For daily minimum MAP values, we look for a jump of more than or equal to 4 centimeter. For PEEP, we look for jump of 3. Here the term used is mean airway pressure, we look for jump of 4, more than or equal to 4. And I told you for PEEP, we take anything between 0 to 4 as baseline and equivalent, yes? For 0 to 5 is equivalent. Here for MAP values, if it is an infant less than 30 days, 0 to 8 is taken as equivalent. If more than 30 days old infant, we take 0 to 10 as equivalent. Clear? Next, coming to what is this PED VAE? It is a single step algorithm. Okay. There are mechanical ventilation criteria is same as what we use for adult. The patient has to be mechanically ventilated for at least 2 days or more, followed by baseline period. The definition of the terminologies, the numericals I told you just now, same thing, that varies, whereas the concept of baseline and increase from baseline to worsening of gas exchange remains the same. You should have 2 days of baseline followed by 2 days of worsening of gas exchange, but the worsening of gas exchange definition varies. For FiO2 you should have a jump of more than 0.25, for MAP you should have a jump of how much? 4. Okay. That is the difference, otherwise the concept here is same. Clear? I am not going to read all this due to lack of time. Okay.
It is same what was discussed earlier.
If adult VAE is clear, this is very easy.
Only thing is there is no VAC, IVAC and PVAP.
It is a single step definition.
If this criteria is met, you are going to level that as PED VAE. Okay.
Yeah. Yeah, all definitions, daily minimum definition, window period, event, all those applies except for those 3, that is VAC, IVAC, PVAP, remaining almost all are the same here. Okay. So, next, this is the end of the session.
We have sent you in the WhatsApp group one link, VAE calculator link. Okay.
For the purpose of learning, CDC has developed.
You can check your group. One VAE calculator link we have sent.
So, for the ease of learning and also to use it on bedside, CDC has developed this calculator. You just have to feed the values. It will tell you whether the criteria is satisfied or not. It will come as, if you just enter the daily minimum value, that is the minimum thing we have to do. You enter the daily minimum PEEP or FiO2 and click on calculate VAC. It will tell you whether VAC is fulfilled or not. Likewise, next step you can go select the drug, you can select what all drugs are given on which day, which consecutive days or how is it given. It will tell whether IVAC criteria is fulfilled. Along with the clinical criteria, you have to load the antibiotic criteria. So it is more of a mechanically you will get the results, and also you will get an explanation. If it comes as no VAC, if you just click the button, it will tell why it is not a VAC. Okay?
So it will help you to find out your thought process is correct or not. Okay. So whatever doubts you have, if it is 6, 7, if it is 9, 10, in such case it will fit or not. All that those values you put here. The calculator itself will tell you that it will fit or it will not fit. If it will not fit, it will tell you an explanation why it is not fitting. Okay?
Okay. No, PVAE is also there. Recently the app was released, both adult and pediatric, the calculators are available. What we have shared is adult calculator, but if you go back, just one link back, you get even PVAE calculator. So, thank you.
Okay, so SSI surveillance is there. So what you want now, lunch or SSI surveillance?